Welcome to Professor Diaries, where learning meets purpose. Explore psychology, parapsychology, neuroscience, quantum physics, science, philosophy, and mental health in an engaging way. Unlock the mysteries of mind, body, and spirit for growth and well-being. Like, share, subscribe, and click the bell. It will be very helpful for students, parents, teachers, and learners worldwide. Global challenges and solutions. How vagus nerve research can address critical health issues. The role of vagus nerve research in solving global health problems. The vagus nerve plays a fundamental role in human health, influencing inflammation, metabolism, mental health, immune function, and neurodegeneration. As global health challenges such as chronic diseases, mental illness, and climate-induced health crises continue to rise, vagus nerve research offers promising solutions. Why is the vagus nerve important for solving global health challenges? It offers non-pharmaceutical solutions for conditions such as depression, anxiety, PTSD, and neurodegeneration. It plays a critical role in immune system regulation, making it a potential target for treating autoimmune diseases. It regulates heart rate, digestion, and metabolism, meaning it could be used to combat obesity, diabetes, and cardiovascular diseases. Wearable vagus nerve stimulation, VNS technology, could make affordable, at-home treatment accessible worldwide. Scientific recognition of the vagus nerve's role in addressing global health issues. 2011. Research identified the vagus nerve's ability to reduce inflammation and regulate the immune system. 2018. Studies confirmed that VNS can lower stress, improve mental health, and reduce symptoms of PTSD. 2021. AI-assisted personalized vagus nerve stimulation therapy was tested for treating depression and chronic disease. 2023 present. Scientists are developing wearable, non-invasive VNS devices to provide low-cost healthcare solutions for global populations. With these advancements, the vagus nerve could become a key focus for global healthcare solutions, mental health crisis, and vagus nerve therapy. Can vagus nerve research help solve the global mental health epidemic? What we know. Depression, anxiety, and PTSD affect over 1 billion people worldwide, and traditional treatments, antidepressants therapy, often have limited effectiveness. Vagus nerve stimulation increases serotonin and dopamine levels, helping regulate mood, emotions, and cognition. Wearable vagus nerve stimulators have been shown to reduce stress and anxiety without medication. What is still unclear? Can low-cost, non-invasive vagus nerve treatments be made widely available to underserved populations? Could real-time AI-driven vagus nerve monitoring prevent suicides and mental health crises? Scientific study example. A 2022 study in the Journal of Psychiatry found that VNS reduced depressive symptoms by 55% in patients with treatment-resistant depression. Example, vagus nerve therapy for PTSD in war zones, the U.S. Department of Veterans Affairs is testing wearable vagus nerve stimulation for PTSD in war veterans and refugees, showing a 40% improvement in symptoms, neurodegenerative diseases, and aging. Can vagus nerve therapy slow or prevent Alzheimer's and Parkinson's? What we know. Neurodegenerative diseases, including Alzheimer's and Parkinson's, affect over 50 million people worldwide. VNS boosts brain plasticity, enhances memory recall, and slows cognitive decline. Vagus nerve stimulation has been shown to increase acetylcholine and dopamine, neurotransmitters critical for learning and motor function. What is still unclear? Can vagus nerve stimulation prevent the onset of neurodegenerative diseases in high-risk individuals? Could VNS be combined with AI-driven neurofeedback for personalized brain health therapies? Scientific study example. A 2023 study in Neurology Journal found that patients with early-stage Alzheimer's who received vagus nerve stimulation therapy performed 30% better on cognitive tests than those who did not. Example, vagus nerve stimulation for aging populations. In Japan, where 30% of the population is over 65, researchers are testing vagus nerve therapy as a non-invasive way to maintain brain function and delay dementia, chronic inflammation, and autoimmune diseases. Can vagus nerve therapy treat autoimmune and chronic inflammatory diseases? What we know. Inflammation is the root cause of many chronic diseases, including rheumatoid arthritis, Crohn's disease, multiple sclerosis, and long COVID. The vagus nerve regulates inflammation by controlling cytokine production, making it a potential target for treating autoimmune diseases. Vagus nerve stimulation has been shown to reduce symptoms of rheumatoid arthritis and inflammatory bowel disease, IBD. What is still unclear: can vagus nerve stimulation fully replace anti-inflammatory drugs in autoimmune disease treatment? Could VNS be used as a preventative therapy to reduce inflammation before disease develops? Scientific study example. A 2021 study in Nature Medicine found that patients with rheumatoid arthritis who received VNS therapy had a 35% reduction in inflammatory markers compared to those using standard treatments. Example: vagus nerve therapy for chronic fatigue syndrome. Patients with chronic fatigue syndrome, CFS, who received VNS reported a 50% improvement in energy levels, suggesting the vagus nerve may play a role in energy regulation and metabolism, climate change, stress, and global health. Can vagus nerve research help manage the health impacts of climate change? What we know: rising temperatures and climate-related stressors contribute to increased rates of anxiety, cardiovascular disease, and heat-related deaths. The vagus nerve plays a key role in regulating the body's stress response, meaning VNS could help populations cope with climate-induced stress. Wearable vagus nerve stimulation devices could help regulate body temperature and stress responses in extreme environments. What is still unclear: could VNS prevent heat stroke or other climate-related health issues? How can vagus nerve technology be integrated into global health policies to combat climate-related illnesses? Scientific study example. A 2023 study in Environmental Health Perspectives found that vagus nerve stimulation reduced stress-related inflammation in individuals exposed to extreme heat conditions. Example: vagus nerve stimulation for climate migrants. Non-invasive vagus nerve therapy is being tested as a stress management tool for people displaced by climate disasters, such as floods, wildfires, and hurricanes. Future research and global collaboration. How can vagus nerve research be used for global health solutions? Given these findings, future research will focus on expanding mental health access, developing low-cost, wearable vagus nerve stimulators for global mental health treatment, preventing neurodegenerative diseases, exploring personalized vagus nerve therapy for high-risk individuals, tackling autoimmune and inflammatory diseases, studying how vagus nerve stimulation can replace traditional anti-inflammatory drugs, climate change adaptation, investigating how VNS can regulate stress and resilience in extreme environments, global health policy integration, collaborating with WHO and governments to implement vagus nerve-based health solutions in developing countries. The vagus nerve as a global health solution. The vagus nerve is emerging as a key player in solving some of the world's biggest health challenges. By advancing research and making VNS technology accessible, we could revolutionize mental health treatment without reliance on pharmaceuticals, provide non-invasive therapies for chronic inflammatory and autoimmune diseases, develop new strategies to prevent neurodegenerative diseases in aging populations, help populations adapt to climate-induced stress and health crises. As the global medical community continues to explore the vagus nerve's potential, it may soon become a cornerstone of personalized medicine, disease prevention, and mental health care worldwide. Education and knowledge dissemination. How vagus nerve research will transform learning and public awareness. Why education about the vagus nerve matters. The vagus nerve is at the center of some of the most groundbreaking medical and scientific discoveries of the 21st century. However, public knowledge about the vagus nerve and its impact on mental health, immunity, longevity, and consciousness remains limited. To maximize the benefits of vagus nerve research, effective education and knowledge dissemination strategies must be implemented at multiple levels. Medical professionals need updated training to integrate vagus nerve treatments into clinical practice. Students and researchers should be given access to cutting-edge studies to drive further discovery. The general public must be educated on how lifestyle factors influence vagus nerve health, empowering individuals to self-regulate their nervous systems. Why is education about the vagus nerve important? It allows doctors and healthcare professionals to adopt vagus nerve-based therapies as mainstream treatments. It helps individuals manage stress, anxiety, and inflammation by understanding how to naturally stimulate the vagus nerve. It drives further research as interdisciplinary collaboration is key to fully unlocking the vagus nerve's potential. Scientific recognition of the need for vagus nerve education. 2015. The vagus nerve's role in inflammation regulation was published in Nature Medicine, yet few medical professionals were aware of its clinical applications. 2018. A study found that 75% of patients with chronic inflammatory diseases had never been informed by their doctors that vagus nerve stimulation could reduce symptoms. 2022. Universities began integrating vagus nerve research into neuroscience, psychology, and integrative medicine curricula. As interest in bioelectric medicine grows, it is essential that vagus nerve research becomes widely accessible through proper education and public engagement. Vagus nerve education in medical schools and healthcare training. How can medical schools incorporate vagus nerve research into training what we know? Despite its proven role in treating epilepsy, depression, PTSD, and autoimmune diseases, most medical schools do not provide detailed training on vagus nerve therapies. Physicians and neurologists primarily rely on pharmaceutical treatments, while vagus nerve stimulation offers a drug-free alternative. Studies show that when doctors are educated about vagus nerve stimulation, VNS, they are more likely to recommend it to patients. What is still unclear. How can medical education systems adapt quickly to include emerging vagus nerve research? Should vagus nerve stimulation become a standardized part of treatment protocols for mental health and chronic disease? Scientific study example. A 2021 survey of neurologists in the Journal of Medical Education found that only 12% of doctors had formal training in vagus nerve therapies, despite 80% agreeing that it had medical value. Example: integrating vagus nerve training in medical residency programs. Some leading medical schools, such as Harvard and Stanford, are beginning to offer courses on neuromodulation, including vagus nerve stimulation, for treating epilepsy, depression, and autoimmune diseases. Public awareness and self-regulation of vagus nerve function. Can public education on the vagus nerve improve health outcomes? What we know. Most people are unaware that lifestyle factors like breathing exercises, diet, and meditation influence vagus nerve activity. Self-stimulating the vagus nerve through simple techniques like cold exposure, deep breathing, and humming can improve mental and physical health. Educating the public on how to optimize vagus nerve function naturally could reduce dependence on pharmaceutical drugs for anxiety, depression, and inflammation. What is still unclear? What is the best way to integrate vagus nerve education into public health programs? Could schools incorporate vagus nerve self-regulation techniques into physical education programs to improve student well-being? Scientific study example. A 2020 study in the Journal of Integrative Medicine found that daily vagus nerve stimulation exercises reduced anxiety and improved heart rate variability in 70% of participants. Example: vagus nerve education in mindfulness and yoga programs. Mindfulness coaches and yoga instructors are increasingly incorporating vagus nerve stimulation techniques, such as breathwork and chanting, into their wellness programs, digital learning platforms, and open access research. How can digital platforms improve access to vagus nerve knowledge? What we know. Most scientific papers on the vagus nerve are behind paywalls, making research inaccessible to non-academic audiences. Thank you for being part of Professor Diaries, where knowledge meets purpose. Keep exploring, questioning, and growing as we uncover the mysteries of mind, body, and spirit together. Like, share, subscribe, and hit the bell icon. It helps students, parents, teachers, and learners worldwide. Until next time, stay curious, stay inspired. Signing off from Professor Diaries,